So I've been launching my online service as a physio for the past month or so, with 3 different options for you to work with me, either privately within kind of a group program, which is sort of a semi-intensive over 2 months, or within sort of a physio subscription-based program, which is we create information each week and you can take and implement which bits are suitable for you so you can help your back at home. So I've had a private message to ask him, am I even qualified to do this, and how can I offer this service as an online, and am I insured? And the answer is yes. I have been a physio for 30 years. I have a bachelor's degree in physio, and I've done my master's in manual therapy as a physio as well. I am fully clinically Pilates trained. I've done a full comprehensive program through Polestar and STOT and various other methods, and obviously acupuncture, manual therapy, mobilizations, etc., etc. So yes, I am qualified. Why do it online? To be honest, as a physio, I'm finding it increasingly concerning that there is a lot of people who have back pain, who have knee injuries, ankle injuries, shoulder injuries, whatever it is that they've got going on or you've got going on. And you put yourself and your faith in the hands of people who are not trained to deal with injury. And I am not knocking everybody. You know, there are definitely some good trainers out there. There's some good massage therapists. There's some good Pilates instructors. There is some good people who are in other professions. However, I'm finding it very concerning that people that don't have any clinical background, clinical knowledge of pain and injury and how that affects how we move, are offering to fix backs and fix chronic pain, and come to me, I'll sort your shoulder out, come to me, I'll sort your knee out, come to me, I know exactly what I'm doing for back pain. And I've even had it when my clients have been, you know, I've been looking after them for a while, and till they get to the point where they can go back into the gym, and I've told them exactly what they shouldn't do because of their clinical or their problem, and their trainer has ignored it, and they've come back to me going, I'm far worse again. So whilst I get it, as a physio, it is always the best to see people in person. It's always the best to be able to feel what's going on. It's always the best to be able to palpate and, you know, find out what is stiff, what's not working, what's tight, how your actual tissues feel. Personal trainers don't do that anyway. You know, how do they know that what they're feeling is what they think they're feeling? You know, my fingers technically are so sensitive now that I can feel different structures under the skin or different structures under muscle, and I know what I'm feeling for and how it feels, and also how joints move and how they feel. But my knowledge, even online, even just looking at you and being able to see how you move, see what your quality of movement is, and see how you function, and see how you basically use your mechanics. I'm at the point now where I can look at somebody before I even see them, and what they're doing and what the history they're giving me. I know what I want to check. There's 100 things that I know which 5 I want to look at. If I'm looking at you and you're talking to me, I automatically know, is it a loading problem? Is it a fatigue problem? Is it this problem? So I know what I'm honing into. So I'm not flying blind. I'm flying with a bit of information behind me, and then I know what I want to look at. So to put that at rest, after 30 years of physio, I think I'm qualified to help you. And if I can't help you, I'm qualified to know where you need to be looking or sent to, or referred to, because, you know, after 30 years, there's heaps of things I don't know. There's heaps of things I want to know, and there's heaps of things that I know are beyond my scope, and that's what we have sports med doctors for, that's what we have orthopedic surgeons for, that's what we have neurosurgeons for, that's what we have the next level up from me. My job is to look at you and look at your body and look at where your pain and your problem and your injury is right now. Does it make sense with how your body is presenting with the history you're giving and the symptoms you're giving and how your body is also performing to be where you are? And if so, how do we move you forward? And my concern with personal trainers or massage therapists or people who don't have that clinical or medical background is that you're not overlaying the stages of healing or the stages of disease or what is actually going on in that process within how you want to then move forward. So yeah, I do think I'm qualified. And if I'm not, and if I'm not able to deal with it, I know where you need to be. And that's really what it's all about. It's about being present for you as a client, and it's about being present for those people that need it, and it's about being present for those people that want it. And if you don't want this service and you don't want to access physio service online, you're not going to do it. However, if you are in severe pain, chronic pain that hasn't responded, I would urge you to just be wary about who you are going to as your person to look after you and help you move forward, and that understanding what they're saying, does it make sense to you in your brain, does it make sense to you in your head, does it make sense to you in your body, and are you getting the results that you want? Why would you come to me, and why do my clients keep coming back to me? Because I can get you from A to B far more quickly. If you see me one-to-one, I can get you where you want to be a lot more quickly because I have the knowledge and the expertise and the ability to place your presentation or how you are at the moment alongside your stages of healing or your stages of pain or your stages of disease, so I know where to go and I know how to get you there and when to pull back and when to push. And that is the benefit that you're getting from seeing somebody like me. Can a personal trainer get you there? Can they get you stronger? Yes. May there be some hiccups? Maybe not. Who knows? At the end of the day, it is like saying to a car mechanic who is, their expertise is four-wheel drives and you're taking a manual to them, or you're going to an auto electrician to try and fix something that they're not going to fix for you. You have to look at what you want and where you're at and what your body is, and who you go to, are they able to get you where you want to go? So that's why I've become online. It is a little bit upsetting to see how blasé people are about their bodies, and that the advice that's given out is completely and utterly bullshit in some respects, and in other respects it's like, oh my god, that's amazing, why aren't more people seeing you? And why are people trusting you with their body? Because you're very confident, you speak the speak and you walk the walk and you talk the talk, but you're talking out of your ass. So yeah, be discerning. If you don't want to see me, don't book with me. If you do want somebody that knows what they're doing and can get you to a level that you can then progress onto where you want to be, book me. Message me if you'd like more info. And yeah, if you're not getting the results you want, then have a think why. And if you do need to get a consult just to get some guidance and have a bit of direction with what you're doing, then that's what someone like me is here for.